Last week, your top experts were saying that we should expect 100,000 to 240,000 deaths in this country. You've been talking about how it looks like maybe things are plateauing. Are these numbers now being revised downward? I know you don't want people to stop social distancing and that sort of thing, but what can you tell us about the numbers? Are they being revised?
My impression, Jim, is those were the numbers that were set, and they were set as an expectation from quite a while ago. I think we're just doing much better than those numbers. If either of you would like to talk about that, it's a fair question. You want to come up, Deborah?
Yeah, so I think all of you, many of you have done the analysis of the same models that we utilized, and if you do the models of the models, you end up with that range. At the same time, we carefully looked at Italy and Spain, and we are doing much better in many cases than several other countries, and we're trying to understand that. We believe that our healthcare delivery system in the United States is quite extraordinary. I know many of you are watching the Act Now model and the IHME model and they have consistently decreased the mortality from over almost 90,000 or 86,000 down to 81,000 and now down to 61,000. That is modeled on what America is doing. That's what's happening. And I think what has been so remarkable, I think, to those of us who have been in the science fields for so long is how important behavioral change is, and how amazing Americans are in adapting to and following through on these behavioral changes. And that's what's changing the rate of new cases, and that's what will change the mortality going forward, because now we're into the time period of full mitigation that should be reflected within the coming weeks of decreasing mortality. I mean, that's what we really hope to see. We are impressed by the American people, and I think models are models. I've always worked on validating. I spent my life validating models all over the world, and that's why we do surveys and surveillance, and we make sure that what we think is right is right. I think this will change how people look at respiratory diseases, because it will change what is possible when the globe, and particularly the American people, do this level of mitigation. And I think, as I talked about yesterday, we are still in awe, really, of the American people's strength in this and following through.
Yeah, I'm going to do that. I'm going to ask Bob to come up just for a second. Director, I think that's it. They have done, everybody has done, everybody a great job. So those were original projections, and we don't want to say anything about beating it yet, but I think we will have a very good chance to beat them very substantially. Bob, please.
Thank you, Mr. President. I just want to add to what Ambassador Burke said. I mean, this is a consequence of the commitment of the American people. You know, a lot of us have always had challenges changing behavior, whether if it's exercising regularly or different habits with smoking. When it affects us. What's been remarkable to watch here is how the American public has changed their behavior when it protects the vulnerable. I think that's really what I'm so proud to see.
Mr. President, just